Hi, I'm Ronald Wagner, and this is my evaluation plan for Project Hope. A little bit of background on Project Hope. So the opioid and opiate and other drug overdose rates have been rising in recent history, as well as drug abuse and addiction rates. They've also been increasing. If you look at the figure to the right, it's from the Department of Health and Social Services in the state of Alaska, Epidemiology. It was published in April of 2017, but it's data from 2005 to 2016. It's going over the trends of overdose deaths by drugs, and it's the age-adjusted death rate, and it shows all opioids, heroin, other illicit opioids, and then prescription opioids. So what Project Hope is it's a program ran by the Alaska Department of Health and Social Services, and their aim is to distribute overdose response kits across Alaska, and their target population is those who have the highest risk for overdose. Some stakeholders include emergency responders, law enforcement, medical professionals, drug abusers, addicts, friends and families of drug abusers and addicts, pharmacies, Alaska Board of Pharmacy, drug abuse addiction treatment centers, Department of Health and Social Services, hospitals, taxpayers, and other regulatory agencies. This is my logic model. So it starts with the inputs being staff, volunteers, time, materials, money, equipment, overdose response kits, services, educational material. The outputs would be to distribute the overdose response kits and to engage the target population through education, awareness, and distributing the kits and administering the Narcan if needed to save lives and things like that. And the participation would be measured with the number of kits distributed, the overdoses reversed, and other costs related to the opioid and drug abuse. Short-term impacts, or short-term outcomes and impacts, would be the increased access to and the distribution of the opioid overdose response kits, any gained drug abuse knowledge and awareness. And then medium term would be any decreases in opioid and drug abuse, drug addiction, drug abuse treatment, numbers or addiction treatment numbers, including recovery, which is more falls into the long term. Long term is basically the decreases in the same indicators. And the situation is that the program is needed to address the opioid epidemic in Alaska because of the increased overdose death rates and drug abuse and addiction. And this is assuming that the program is going to save lives and reduce drug abuse, increase education awareness, and all of that. And the external factors are whether the kits are actually used by those who they're distributed to, or if they just kind of sit there and don't fulfill their purpose. So the evaluation goals are to determine project strength and weaknesses, if it's worth the logistical and financial cost to be effective, and how well the program caters to different demographics and cultures, especially being in Alaska, very diverse, and a lot of rural communities and such. And then how well it reaches its target population and does what it's intended to do, which is to save lives and reduce drug abuse and addiction-related statistics, and then also to identify potential ethical issues is another goal of the evaluation. So some of the methodology and the needs of the program. So the needs, one big indicator to me is that the total estimated drug-related costs in Alaska for those 12 and older is about $1.22 billion. This was estimated by the McDowell report and was released in 2017 in March, but it's for 2016. And then overdose deaths, drug abuse, and drug addiction rates have also been steadily increasing over the past decade, like I've said and showed on the first graphic. And the design of this evaluation plan, the format will be a summative evaluation in order to determine the effectiveness of the program and how well it is efficient and could be improved. And then other focuses, as I mentioned, will be the ethics and the cost worthiness of the program compared to that of other programs that try to address the same issues. The analysis plan will be focused on the cost effectiveness, which relates the cost to the key benefits and outcomes. You want to maximize the effectiveness per cost. And then we want to look at the cost benefit, which attempts to determine the ratios of total program cost to the cost value of the total benefits to society of the program compared to that of the other programs. just to see if there's any other program that could have similar effects for a better value, because this program is costing millions of dollars in federal grants, plus a lot of other volunteer time and state time. And we also want to look at the net benefit of the program to see just what benefit it has, and whether it's worth it and everything. And then the dissemination of the results will be through as many forms of media as possible, because in the readings it said that the more forms of media that the results are disseminated through, the more people it will reach, and the more it will be received by the public in total, which is the goal of the dissemination of the results. You want it to reach as many people as possible and as many friendly forms of media as possible to them, so it's accessible to everyone, or as many people as possible. And the interview instrument, so it was intended to be given to those who work with people at risk for overdose or drug abuse, such as medical professionals or medical administrators that work in the places where the overdose response kits will be given out. We're going to ask them how beneficial do they think the program is on a scale of 1 to 10, how useful the information in the program was, if they thought that the kits helped to reduce overdose-related costs, if they thought it was a good way to combat the opioid epidemic in Alaska, if their agency ever runs out of overdose response kits, and the percentage of those who received the kits were enrolled in Medicaid, and then if they thought Project Hope has reduced drug abuse issues in their community or not, and if the people who use their kits have health insurance, and what age groups of populations who benefit from the project belong to, and then the races that they think that the people that benefit from the overdose response kits belong to in their communities that they've personally seen. And the focus group will have a welcome, an overview, and then a discussion with these questions and prompts and probes, and then a conclusion at the end. The first question will be what their name, their job title is, their experiences with the program, kind of an introduction for everyone. And then they'll be asked what their impressions about the project is and why, just to get things started, and then what ways they think it's impacted their clients and their families, their loved ones, the community, etc., just to get things going even further. And then what some things that they think could help increase the effectiveness and the benefits of Project Hope are, in order to get some useful feedback for the evaluation and how to improve the program, what they liked about the program, what they disliked about the program, complications they experienced in the program, all things that can help us improve the program. And then if they think it's worth the cost, because these people see it every day, so they would know more than anyone the actual qualitative benefits that the program is having in real life more than anyone else, and they could provide a lot of useful feedback on that to justify it ethically and everything like that. And then any other things that they think could be done to improve the program, and just some probes, like why do they think what they think, if they could expand on what they said, and other things to keep the focus group in line and to expand on useful things. That's all I have. That's my evaluation plan for Project Hope. Thanks, bye.